Hi everyone. Today in this video let us talk about Docusate sodium. The drug Docusate sodium is one of the fecal softener. This drug can be indicated for the short-term management of constipation. As this drug reduces the hardness of fecal matter, the stools can be easily passed through the colon, resulting in the softening of stools and less effort for defecation. And here within the name we can identify the chemical nature of this drug. The prefix doc indicates this drug is having dioctyl moiety. So it is having the two 8-carbon chains within the structure. And the letter U indicates it is having the sulfo moiety. Finally, the suffix ate indicates it is having the succinate moiety. Docusate is a dioctyl sulfosuccinate derivative. And since this drug is having the sulfonate moiety, this drug acts as anionic surfactant. So this drug acts as an ion exchanger and it reduces the surface tension. So this drug can reduce the surface tension of the stools so that water and other minerals can enter, resulting in the softening of the stools. This permits less effort for defecation, thereby it relieves the symptoms of constipation. Now let us see how this drug acts. Within the colon, the movement of fecal matter may be reduced, resulting in the formation of hard stools or dry stools. In such conditions, we can give Docusate sodium, which are non-absorbable, so they are retained within the colon. And they are going to act on these hard stools where they are going to reduce the surface tension so that their surface area is permeable to both hydrophilic as well as lipophilic moieties. Now, one of the hydrophilic moiety is the water, which can enter into these hard stools, resulting in the softening. And few of the ions like potassium can also enter, resulting in further softening of the stools. Now these stools, because of softening, they can be easily movable, which results in the easy movement of fecal matter, leading to less effort during the defecation. In this way, Docusate sodium can reduce the symptoms of constipation. Now let us see the chemical nature of this drug. So this is the structure of Docusate sodium. Here we can observe sulfonate moiety is attached to the succinate moiety. Here we can observe the two ester moieties. Let us give the numbering 1, 2, 3, 4. So at the first position and fourth position, it is having the ester. Apart from that, it is having the sulfonate moiety at the second position, which should be given preference. So we can write this as 1,4-dioxo-butane 2-sulfonate. So to the 4-carbon chain at the second position, sulfonate moiety is present, which is responsible for surfactant activity. As it is having the anionic charge, it can easily exchange the sodium so that it can reduce the surface tension of fecal matter. At the first and fourth position, two long chains are present. Let us give the numbering. This is 1, 2, 3, 4, 5, 6. So it is having a 6-carbon chain along with ethyl side chain. Totally 8 carbons are attached. So it is an octyl chain. Similar chain is also present at the first position. So we can represent this as 1,4 bis. Bis indicates two similar chains are attached, and this chain is nothing but 2-ethyl hexoxy, as the hexyl chain is attached through the oxygen. So that is the name of Docusate sodium. Now let us see the precautions of Docusate sodium. This drug should be carefully given in those patients who are observed severe nausea and vomiting and any abdominal pain. If these symptoms are persisting even after 1 week of treatment, then this drug should be contraindicated. Similarly, Docusate sodium is given by either oral route or rectal route. So this drug may produce gastrointestinal bleeding, or when it is given as enema, it can also produce a rectal bleeding. So again, in such conditions, this drug should be carefully given. Now let us see the side effects of this drug. The important side effects mainly include diarrhea, skin rashes. It can also produce some throat irritation, nausea and vomiting, and abdominal cramps can be observed with this Docusate sodium. How it is given? This drug is given by oral route as well as rectal route. By oral route, it is available in different dosage forms such as oral syrup, capsules, tablets. So by oral route, this drug is given at a dose of 50 to 300 mg per day, given as divided doses. It is also available as rectal route in the form of enema. So around 1 to 3 enemas can be given per day for treating the constipation in the adults. So that's about this drug Docusate sodium, which is a fecal softener which acts as a anionic surfactant so that it can reduce the surface tension of the fecal matter, which allows the permission of water, lipid and ions like potassium. By all of these may result in the softening of fecal matter. So this reduces the symptoms of constipation, but this drug should be used only for short-term period for less than 1 week. When the symptoms are persisting for more than 1 week, then this drug should not be used. GI bleeding and rectal bleeding may be observed with this drug, and it can also induce the nausea, vomiting and abdominal cramps, which should be carefully monitored. So that's about this drug Docusate sodium. Hope you have enjoyed this video. If you like this video, please subscribe to our channel, share this video with your friends, post your comments in the comment box. Thank you for watching this video.